Good afternoon. I'd like to welcome all of you to our open house. We're really so glad that you're here. And this gathering with all of you coming together is one of the ways that we bring all of us together across our geographies, across our backgrounds and our perspectives to reflect on our collective progress and the shape of what is going to come next. My name is Gail Brown, and I am a member from New Hampshire, and I've been with this Oral Health Network, this group that's growing since 2013. I'm really proud to be a part of OPEN's Member Engagement Committee, the group that is responsible for bringing together this event. And I've got with me today my co-host, Tony from Michigan. He's here to help me give you a really big open welcome.
Hey, everybody. And again, we say welcome. This is just not another Zoom meeting. It's a place where we connect, we learn, we co-create solutions to bring equity to oral health and beyond. Your participation today is the reason that this network is thriving. Everything you see here, this event, the tools, the committees, the topics, has come from your feedback, your questions, and your ideas. So we want to say thank you. And we want to invite you to keep your cameras on if you're comfortable. Jump into the chat, show up whatever way you feel most comfortable. And please, 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 I started to do it like James Brown. Please, please, please do not forget to fill out the evaluation at the end. We really do use this information to improve our sessions and how the reflects your network needs.
So here we go. So here's what we have lined up for you today. First, we're going to welcome our new members. We had quite a few that signed up to join us. We're going to talk about who we are together as a network, and then we're going to dive into the open resources. How can you get involved? We're going to provide quick updates from each of our committees. And after that, we're going to break into small groups to explore key topics and then come back to share our final reflections as a full group. This is about building connections, sharing power, not just information. Everyone in this space has something to teach and something to learn. So let's make the most of our time here together today.
So let's kick things off with some newcomer introductions. If you're new here, we want to say welcome, and we'd love to know your name, where you're joining from, and what brings you to this work. As of yesterday, we had 52 people registered, yes, to join us today. And so we'd like to ask any newcomers if you would raise your virtual hand. And if you'd like to introduce yourselves, we'd like to make time for everybody. So please keep it to your name, where you're calling from, and what brought you to open. And if you're not interested in coming off of mute, please use the chat and tell us about you. We're very anxious to meet you. And seasoned members, let's make all of our new members feel very welcome. So we're ready for you to introduce yourselves. And Gail, are you seeing the screen? Can you call on people or?
I don't see it.
Okay.
Francis, could one of you help us with that?
Yes,
Hello, I can go first. I'm sorry. My name is Brittany Clark. I am in Florida. I am a health adjunct professor at Florida A&M University, and I focus on health with direct correlation to oral health.
And what brings you to open?
Oh, I'm sorry. I come to open because of several other organizations I'm a part of introduced me to the open, but I'm already a part of CareQuest, and I do the seminars monthly with CareQuest. I just never joined the open side of it. So that's basically just bringing it full circle.
Awesome. Well, welcome.
Thank you.
Who's next?
Hi, I can go. I'm Lauren, and I'm with the American Academy of Pediatric Dentistry in the Research and Policy Center, and it's nice to see a lot of familiar faces. I've been in the oral health space for like almost 2 years, and so I'm just interested in learning more and connecting with other advocates. So that's what brought me to Open.
Great, welcome. And I heard another hand go up.
Yeah, go ahead, Brenda.
Yes, good afternoon, everyone. I'm Brenda Leith, and I am at the Public Health Institute, which is based in Oakland, California, though I work remotely there, and I'm actually in the District of Columbia. What brings me to Open is I am new to CareQuest, and I have an interest in trying to promote oral health care for people with intellectual and developmental disabilities. And I saw this as an opportunity to connect with others who can help me to advance this mission.
Awesome. Thank you. And who's next?
Shauna?
Shauna, unmute yourself and go right ahead.
Okay, we'll come back to Shauna. How about Valentine?
Hi, good afternoon, everybody. I'm Valentine Felix, and I'm joining from Ultimate Health Services in California. What brings me to Open? I'm a dental clinical quality analyst for Ultimate, and this is a new role. And I feel like I've stepped into advocacy within my nonprofit here, and I feel like I've been using CareQuest resources a lot. And I newly learned about Open, so happy to be part of a group that advocates and shares power, like y'all said.
Welcome. Awesome.
Okay,
About
and
3 more
Lisa.
minutes. Who else might be out there that's new?
Hi, I'm Lisa Pucello. I'm from the Institute for Family Health in New York. I have used some of the resources of CareQuest, and I saw this opportunity to join. And with so many changes going on and new regulations, I just thought it would be great to hop on.
Excellent. Welcome.
How
Shauna,
about
did
one
you
more?
Shauna, did you want to try again? Oh, I see. Audio issues. Okay, Steve, I see you're the last hand.
I am Steve Geierman. I am literally an old face, but also an let's just say a veteran with Open who has taken a little bit of a break. I'm retired, but I'm currently spending a lot of time working with the Association for Dental Safety, formerly OSAP. I live in Chicago. And what brought me back to re-engage with Open is the advocacy piece in light of our crumbling infrastructure and seeing free speech fall to the wayside. I think we need to have some common ground there. And Open has always thrived with that. So thank you.
And thank you, Steve.
Thank you, Steve. I think that is a great overview of who's on the line here today. I can tell all of you who took that time to share that you are in the right place, and we're glad to have you all. So it's wonderful to meet you. We do this piece because the relationships are really the heart of our systems change. In fact, it is often one of the most important factors when people talk about what do they value most about our network, and that is the relationships. So, and the shared work. So let's get down to it on all things open. Okay. Open, as many of you know, stands for the Oral Health Progress and Equity Network. We are a nationwide network of people and organizations that are working to fix the systems that shape oral health. The systems for too long that have left us people behind, that we have populations, geography that are just not being served. So here we are. Open is powered by CareQuest Institute for Oral Health. Several of you have mentioned that you're new to CareQuest. It is a nonprofit that is championing a more accessible equitable, and an integrated oral health system. This connection gives us stability, opportunity for strategy, and the support that allows all of us to focus on a network-fueled change. CareQuest shares our values and helps us to scale solutions that are rooted in our communities.
Today, we'll get a high level and overview of the network as a tool to facilitate systems change. And how we do this is through shared leadership, strategic partnerships, and a strong commitment to justice, equity, diversity, and inclusion.
So Open has a commitment to justice, equity, diversity, and inclusion. Yes, I did repeat that, and I did that on purpose because those are not just buzzwords. They are really the bedrock of everything that we do here. We believe that oral health is a human right, and we know that equity does not happen automatically. And that is an issue we're seeing more and more every day. This slide shows what we refer to as Open's Jedi statement. Justice, it means for us repairing harm. Equity, meaning fair access and opportunity. Diversity, honoring our differences. Inclusion means everyone has a voice. And that's why we organize around and together and across the silos and sectors to build power, shift policies, and drive the change that centers people most affected by health disparities and disparate outcomes.
We know that oral health is deeply shaped by racism, classism, ableism, and systemic neglect. We know that these patterns play out differently across communities, from underfunded tribal programs to language barriers for immigrant families to a lack of dental providers in rural and urban communities. That's why JEDI isn't just an add-on for Open. It is literally our frame. It guides how we do our work. It guides how we collaborate and how we measure success.
Next slide, please. So what makes Open different? We know that oral health is an integral part of overall health, but with dental benefits and care that is divided and payment, we do the work to bridge the gaps between community and policy, between data and our real life, between health systems and the people that we are supposed to serve. We amplify the voices that are too often ignored, bringing together dentists, public health experts, grassroots organizers, Medicaid leaders, community advocates, and more. And we put them all under the one big open tent. We are a learning network, we are an action network, and we are a support network. And we believe that real systems change happens when diverse people come together with a shared purpose and vision.
When we say grassroots, this is what we mean. Grassroots work is driven by people with lived experience. It's local, it's collective, it's about changing conditions on the ground and shaping the bigger systems that affect the lives of people. This includes everything from coalition building and direct service to organizing campaigns, storytelling. Grassroots work is how communities make their power visible and undeniable.
We're going to take a look at a quote from Margaret Mead, one of my favorite quotes. And we'll go, there we go. I was going to say, we're going whether the slide comes up or not. Margaret Mead reminds us to never doubt the power of a small group of thoughtful, committed citizens to change the world.
This is the spirit of Open. We're committed to working together to make practical, actionable change happen. We're not here to fix people, but we're here to fix systems with the wisdom of those most affected leading the way. So what does the network actually do? Well, here we'll talk about some of the ways that you can get involved and what to look out for in 2025.
Open uses a collective impact model, and that means that we coordinate our efforts across a shared goal and we align with common measurements. We keep our learning together. These 5 principles you see on this slide are the ways that we organize the work of the network. It's not about one hero doing all of the work. It's about bringing people together to ensure that all of us are rowing in the same direction.
Are you wondering what that looks like in action or looking for ways to get involved? Well, join the next advocacy committee meeting on October the 2nd to support the network's common policy agenda, or get involved with the Community Water Fluoridation Learning Collaborative, a group that was formed in response to the threats of water fluoridation changes that are going on. This group will meet on September the 25th. These spaces are where ideas become actions and where your voice can be heard.
Keep your eye on the chat, and you'll be seeing opportunities to link and register right away, or copy down the link to be able to register later. Also going to remind you to watch for some QR codes, and we'll remind you again, they're going to be coming up. The network also hosts open takes, and typically we do take 20s, take 30s. I hope some of you, and I know some of you have been able to participate. They are excellent targeted learning materials that are being done by your fellow members and or resident experts on the topics. These are relevant to the network's interests. They are TED Talk style presentations and are followed by a brief Q&A to help you clarify and to begin to apply the lessons learned. We have an upcoming Take 30. Medicaid adult dental benefits are not optional. That is happening on September 30, where we'll be learning about the national landscape of the Medicaid adult dental benefits. See that registration just popped up for you. Featuring a hands-on tutorial on the coverage checker tool and a look at how benefits have evolved over time. You'll learn about the implications of HR 1 and other emerging threats that we have on the oral health landscape right now. You will hear from a dynamic panel of experts as they share proven strategies for expanding and protecting these vital Medicaid benefits. And there you go. Scan the QR code or follow the link in the chat to register. And as always, there are more open opportunities coming. So be on the lookout. It's a very busy and active time in our oral health environment.
Absolutely, Gail. And so, speaking about being on the lookout, are you new here or have you been around for a while, but you feel like you're missing some open announcements? If there's one thing we want you to walk away from today doing, it is to complete the onboarding checklist. And I think it's in the chat. And so it's very important. First thing is to complete the membership form, which can be found on our website. And that link should be available to you now in the chat as well. We invite you to get familiar with the website. It walks you through the basics, who we are, how we work, and all the opportunities that are available to you right now.
You are also all invited to register for Open Communities, our virtual gathering space where we share announcements, we share resources, or you can find the connections and information that you need in a new venture. Whether you're leading a coalition, like I do, or just learning what oral health equity means, there's a place for you here. The final item on the list is already in progress. So let us make it super easy for you so you can get plugged in.
And I really think you would want to get on the email listserv from Open. So this is a QR code that you can scan. I like QR codes, by the way. Make things, it's so much easier. And you can fill out a membership form. And this is how you get added to our listserv. You stay in the loop and you hear about opportunities first. So in terms of our membership, there are no dues, there's no gatekeeping, it's just connections. We do ask that you commit to Open's Jedi statement and share some basic background information so that we can get to know your interests better. And this will give us an accurate picture of our network composition.
And a friendly reminder to all of you who are our seasoned members, Dr. Geierman. This membership form was launched last year, so please make sure that you have completed it. I'm going to have to check on mine because I'm not sure. So there's a little homework piece for everyone.
Absolutely. And as we mentioned, the form can be found on our website. And here's what it looks like. Here's our website that should be up. And our website is your one-stop shop for all things open. You can find resources, register for upcoming meetings, watch past webinars, and stay current on what's happening in the network. So bookmark it, share it, and use it.
All right. Here you can see the landing page for the open communities. Think of the open communities as our virtual hallway. It's where conversations happen between the meetings. It's where questions can get answered and where resources live. So it's free, it's easy to use, and it helps you stay connected no matter where you are in the country or what time zone, that you can just stop and log in and it's there for you.
So we want you to meet the CareQuest staff who support this network. They are here to help with logistics, data, coaching, and strategic planning. They don't lead the work. We all lead the work, but they help make sure that we're not doing it alone. They are our primary backbone support. And we want to thank Frances Walsh for doing a fantastic job. And likely you've seen her name coming through in your inboxes a few times. And by now, and of course, the CareQuest team will soon be expanding. So check out our website and more details on the new open position for a manager of strategic initiatives. I have to say that word slowly, strategic initiatives. And
We might want to make that title a little easier to say, Tony, because I don't think you're alone. All right. And we have some very exciting news to share today that comes from the CareQuest Institute. CareQuest is the backbone support of our open network. And this past Monday, Wade Rakes, here's his picture, and that smile just warms my heart. He has officially stepped into the role of president and CEO of our CareQuest Institute. Wade is a seasoned leader with a strong track record in healthcare, government, and community work. I call it from top to toes. And he's deeply committed to advancing health equity, has spent his career expanding access to care for underserved populations. He truly understands the connection between oral health and overall health, and the critical role that oral health plays in the lives of working families and communities.
we are excited to welcome Wade's vision, energy, and expertise both to CareQuest and to Open. And we're looking forward to continuing to drive meaningful change and build healthier and more equitable communities together. All right, now let's take a minute and talk about the national picture. The oral health system is changing fast, and we all know this. Over the past several months, the CDC's Division of Oral Health has been cut. HRSA lost its dental officer, and more states are proposing bans on water fluoridation. Meanwhile, state and federal elections are changing who's making decisions about health systems. This is where Open steps in. We're not just reacting, we're organizing. And we want to make sure that the people closest to the problems have a seat at the table when the solutions are designed.
Each year, the entire network comes together for our annual meeting. This year, we're gathering at a time of both challenge and incredible opportunity. Across the country, our members are leading change, driving change in policy, in practice, and in community. This year's theme, Power, People, and Partnership, Advancing Community Oral Health, centers our collective energy on what drives change. We'll spotlight community water fluoridation, often called CWF, as a critical equity issue in today's political environment, and equip participants with hands-on training using the new Framing for Oral Health Equity Toolkit from Frameworks Institute. I am really looking forward to that. So this time again, you can scan the QR code on the screen or follow the link in the chat, and you can register easily and quickly.
And I hope you all register. The annual meeting is going to be awesome. So Open is made up of 5 committees that focus on everything from policy and member engagement. These committees truly are where the inspiration happens in our network and the work gets done. So I'm excited to hear updates from around the network about what's underway and what we can look forward to. So with that, I'll turn it over to my fellow Member Engagement Committee member, Lisa Boudon. And take it away, Lisa.
Thanks, Tony. You and Gail are doing a terrific job. And hey, friends and colleagues, Open has always been a place where people share generously, time, insights, encouragement, and where those who have been around for a while, they make it easier for the next wave of leaders to find their footing. That spirit is at the heart of the brand new Open Mentor Program, an initiative of our Member Engagement Committee. The goal is simple: to connect new or emerging members with seasoned members who know the ins and outs of the network. Mentors will help foster belonging, build connections, and guide folks through the open ecosystem. So here's how it works. For this pilot phase, we're inviting formal leaders and former formal leaders to step forward as mentors. Mentors then commit to connecting with each mentee for up to 4 hours over a 4-month period, at least one meeting by video, to share insights, answer questions, and provide encouragement. We'll provide a mentor resource kit with conversation guides, FAQs, and support contacts, so you'll be set up with everything you need. Mentors will also be featured in our new Open Mentor Directory launching in 2026, so mentees can find someone aligned with their interests and goals. Today, you'll see in the chat, we're launching the Mentor Interest Form. If you are a formal leader or a former formal leader, this is your chance to give back some of that same support that's been given to you so freely. We strongly encourage you to sign up and be a part of shaping this pilot year. We'll share the Mentor Interest Form in the link, the link in the chat, and you'll also get it by email after today's session. Please consider adding your name. Your guidance will help welcome and empower the next generation of change makers in Open. Now I'll hand it over to Casey from the Dental Coverage Committee.
Thank you, Lisa. So my name is Casey Wilson. I'm here representing the Dental Coverage Committee. I'm one of the co-facilitators. I'll shout out my other 2 co-facilitators, Bailey Rivas and Stacy Auger, who I don't think could be here today, but it's a collaborative effort. So we can go to the next slide. The Dental Coverage Committee is a group of open members from across the country who connect to discuss their work to protect and expand Medicaid adult dental benefits in their states, as well as work to strengthen dental coverage in Medicare. So the goal really is just to create a space for people to share strategies, connect with each other over similar work that they're doing. And we know that advocates can learn a lot from each other, and certainly there are different contexts state by state, but there's a lot of rich experience and expertise in the network. And so really just try to create a space where people can avoid having to reinvent the wheel and collaborate with each other. We'll also often share information about what's happening on the federal level to ground in how the federal policy landscape might affect ongoing state and community level efforts. Next slide, please. So in terms of our meeting structure, we meet once a month. Typically, meetings alternate between focusing on Medicaid and Medicare. In the earlier part of the year, meetings are often more campaign focused. Most of our members are working to advance policy, and that can include everything from people sharing updates from what's going on in their states to offering advice and resources to each other. And then in the later part of the year, the meetings will often focus on presentations or other longer form information sharing as people are sort of regrounding, thinking about what worked for them, what didn't work that year, and then planning for the following year. Yeah, I think I already said that. Sorry about that. So we can keep going. Yeah, and so some related resources on this slide. I think unsurprisingly, given the current environment, many of these resources focus on the impact of recent federal healthcare changes. And definitely just want to highlight that there is Take 20 coming up. That link is at the bottom of this slide. Focus specifically on Medicaid adult dental benefits. So definitely check that out. And we, of course, invite you to join the Dental Coverage Committee if you're interested in learning more. So I'll pass it over to Laura to talk about the Advocacy Committee.
Hi, it's Ellen. I'm actually stepping in for Laura. I am one of the Advocacy Committee leads along with Laura, Tanya, Annalise, and Joey. And I'm excited to share an update from the Advocacy Committee since we last met in June. We had a great Hill Day in DC in May, and we're building on that work to advance oral health equity. So based on that, Open has developed a common policy agenda that reflects our shared values and strategic priorities. So their policy statements are bold, unified, and designed to guide our advocacy efforts across the network. To build on what Casey was talking about in the Dental Coverage Committee, we're ensuring to work that oral health is prioritized in broader health and public policy conversations. So we're advocating for comprehensive dental benefits in both Medicaid and Medicare, access to care for veterans and people with disabilities, robust federal funding to support state oral health programs. We also believe that oral health must be integrated into primary care and public health systems, and that prevention should be the foundation of public health strategies. Of course, every policy and funding decision must be guided by equity. So if this all resonates with you, please, we'd love to have you join us. The Advocacy Committee's next meeting is October 2nd, just a couple weeks away, and there should be a link to register in the chat. And so we'll be able to start aligning our strategic priorities for the next coming year. Your voice matters. Come help us shape the future of oral health policy. Thank you. And I think I'm going to hand it over to Caroline to talk about community water fluoridation.
Awesome. Thanks, Ellen. We'd love for you to join our Community Water Fluoridation Learning Collaborative. We're a newer group. We meet every 3 weeks, and it's designed for oral health and public health advocates, providers, and policy leaders working at the forefront of fluoride and water fluoridation policy. This is meant to be a collaborative space that serves as a hub to share real-time updates, strategies, and resources like the one that you're seeing in front of you. This is our group toolkit. These resources are related to state and federal developments, including the growing wave of legislative efforts to ban community water fluoridation. We'll also explore proactive strategies to safeguard oral health, especially in communities facing new threats due to fluoridation bans or rollbacks. Participants are encouraged to engage in open dialogue and bring questions, ideas, and local perspectives to help guide and inform our shared approach. So whether you're tracking legislation, supporting local coalitions, or crafting new approaches to preventative oral health, this space is for you, and we would love to have you join.
Hello, I am Jessica Ball. I'm one of the leads for the State and Grassroots Committee. Over the past year and a half, the State and Grassroots Committee has been working side by side to better understand how open members in every state and community are advancing oral health equity. We recognize that while everyone is facing unique challenges, there are also common strategies of development we all cycle through, from early exploration of relationship building to deeper collaboration, to scaling and sustaining community leadership. That's what led us to co-create the state and grassroots engagement playbook. The playbook captures these phases of development, highlights key actions, and lifts up advice directly from open members who have lived them. The playbook is not meant to be a static report on a shelf. It's meant to be living guidance, something we continue to sharpen, enrich, and make useful together. We also see these phases of development as a cyclical process. No matter where you are in the life cycle, you can look forward to utilizing this playbook to support your work and move more meaningfully between phases. We are now building a living library of tools and training materials that flow from the playbook. We know so many of you already have resources you use every day. Templates, guides, toolkits, checklists, facilitation methods. Rather than reinvent the wheel, Open wants to showcase and share what's already been working in communities. That's why we are launching a brand new request for resources form, and you will see the link in the chat. This slide shows all of the different resources types we're looking for. Follow the link in the chat and you'll be able to share tools and resources you've used or developed, and also highlight resources you wish existed. These submissions will populate the playbook and become part of a library that grows with us, reflecting the collective wisdom and expertise of open members nationwide. And now I'm going to hand it over to Anu for an update from the Impact Evaluation Committee.
Thank you, Jessica. Hi, everyone. My name is Anu Shukla. I've been with Open for some time, and I'm very happy to be here. Very nice to see a lot of familiar and new faces. Thank you again. So I'll go over the Open Impact Evaluation Committee. The Impact Evaluation Committee is very new, but what we have been doing is not very new. So the past year, the Impact Evaluation Committee has been working through Open's theory of change and logic models, making sure we have the tools to understand not just how healthy our network is, but also the real impact we are creating together. On the screen, you can see Open's role and some success measures we consider critical to our theory of change. Next slide, please. Oh, no, the previous one. Yeah. Since 2020, Open has conducted the network health assessment every 2 years. This survey has been a cornerstone for understanding how we are doing as a network, how connected we are, and how well we are working together, and where improvements are needed. This year, the NHA has been refined and relaunched. Although it still checks on the health of the network, it's now directly tied to our theory of change and logic models, so we can better track the progress toward our shared goals. The questions have been streamlined, there's no duplication, and they can now have space for both quantitative as well as qualitative reflections like stories of impact. We have also added opportunities for members to give feedback on progress made in areas raised in past NHAs, so we're building on what we've already learned. This survey would take almost 10 to 15 minutes to complete. It's anonymous, entirely optional, and your input is vital. We want to hear not just how the network is functioning, but also the stories and examples of what's working and the changes you want to see next. As an additional way to capture member perspectives, we are also offering optional follow-up interviews. These 20-minute conversations will run from September 25th to October 3rd, and they give the members a chance to go deeper into their experience. Next slide, please. The NHA is due October 2nd, and the results will be presented back to the full network at the annual meeting on October 16th. So please scan the QR code on the screen or follow the link in the chat. And please note that all of these resources will be emailed to you following today's meeting. And as an additional incentive, we will be offering a $10 gift card to everybody that opts in at the end of the survey to provide their contact to receive the gift card. All survey responses will remain anonymous regardless of whether you opt in to receive the gift card. With the launch of the Impact Evaluation Committee, the NHA is evolving from a simple check-in into a true reflection of our collective impact. We encourage everyone here to complete it. Your feedback is how we make Open stronger together, and your voice matters. Thank you so much. I'm not sure who I hand it off to because I think that's the end of the slides.
You're actually going to hand it off to me. This is Gail again.
Okay, thank you.
Thank you. So thank you to all of our committee leads. Your teams are the efforts and the work you're doing is important. You're really making a difference every day. This was the piece of today I was looking forward to the most because I know that there's been so much going on and I wanted that update. So thank you. Thank you. We're going to take a few minutes now and look at any questions you might have, any thoughts you might have, or any shout outs you might want to give. No question is too small. If you're wondering, somebody else probably is too. I probably am myself. So we're going to take a few minutes and we're going to start before we go into our breakouts. Now, I can't see whose hands are up. So if someone in the team can help me, that would be great.
Will do. So feel free, anybody, to unmute yourself, or if you're looking for the raise hand, you can see the reactions button at the center, at the bottom center. If you click on that reaction button, for me, it's a heart. And then you can see the raise hand icon towards the bottom of those options. I'm not seeing any hands yet. And feel free to make use of the chat box as well, if there's any questions, comments. Is everyone busy taking the network health assessment?
Give a quick shout out. I'm really excited about the I want to use the name correctly, but the work that is, and of course I can't find it the second I want it, but the work that's being done around the tool, creating the tool, bringing the information together, and helping us to create that framework that underlies our work and the progress that we're making as we all move forward. I just was not aware of that work, and so I shout out to that team. Thank you. Thank you so much. Did we overwhelm you?
Yeah, no questions.
No questions?
Maybe we were just thorough. I don't know.
Oh, maybe so.
That's good if it's clear information. Okay, should we go on?
Let's go on. Back to you, Tony.
Yeah, we can do some good work here. So today's open house is an important step in building the open state and grassroots engagement playbook. And you just heard Jessica talk about that. So what we want to do is invite everyone here to step into a breakout conversation that feels most relevant to your current work or where you feel you have wisdom to share. We want to take a look at 5 key phrases, and they're in the chat, in developing the state and grassroots engagement initiatives listed on the screen, and decide which conversation you want to be a part of. So we'll have 5 different breakout rooms. We also have a link to a discussion guide and a notes document in the chat. So please take a look to familiarize yourself with the phase that you might be interested in. So together in each breakout, we'll talk about what this phase looks like in real life, which insights and actions resonate with you, and what else would make the phase stronger and more useful in your field. So your feedback will directly help us socialize and strengthen the playbook so it reflects the diversity of the work happening across the United States. So think of today as both a chance to reflect where you are in the journey and a chance to put your fingerprints on this playbook itself. So by bringing your experiences, your questions, your tools into the process, you're helping us to get better at building community-driven, equitable oral health systems that we need.
Great, thanks so much, Tony. And you will see the breakout rooms window pop up. The rooms are unassigned, so go ahead and join which room you are most interested in. I see a few of you are getting started. If for some reason you're unable to join, please provide your name, or please provide which room you would like to join in the chat, and I'll go ahead and assign you. But feel free to go ahead and join whichever room you prefer. Thanks so much.
So we'll go in order. That will be great. So we're looking for a couple, 2 to 3 takeaways from each of your groups. And one of the things we knew about this particular conversation was that things may go in a variety of directions. So if group number 1 does something and group number 2, you went in an entirely different direction, that's okay. We're very early in the developing this process. So don't feel like you have to fit a mold because we haven't created it yet. So how about group number 1? Do you have someone to speak out? Research and partnership building.
So this was actually my group. I was the note taker and we didn't designate a reporter, so I'm happy to unless anyone wants to jump in. But our group got started with some conversation about how things are in Florida right now. There's some publications that are going on with the crisis that's there. So there is lots of literature about the cost of diseases, but where is the research? Especially that link to oral health and overall health for untreated issues, chronic infection, where is it linked to diabetes, to low birth weight, all sorts of range of issues, but being able to speak to that scientifically. We had a wonderful individual, I'll just name drop Rachel Doherty, dropped at least 10 links to some amazing partner building resources, and things like state and local health programs through the public health departments and all sorts of, ways to make connections. We also heard from Shauna in Montana about they've been having some tumultuous relationships with the Dental Association and Dental Hygienists Association and have done a lot of bridge building there. For one particular bill that was giving hygienists an endorsement for limited access permits to things like schools. Anyway, there is a lot of conversation that took place and a lot of resources to support making those connections, building those relationships, and finding all of this wonderful research. So that's my 2 to 3, and I'll turn it off to training, education, and development.
This is Vanessa. I was the note taker. We also didn't really designate a reporter. I don't know, is there anyone from our group who would like to do it? I mean, we had a great discussion. Okay, no problem. I can do it. So we had a really great discussion around what we were tasked to do. So some of the things that that resonated for folks and that people appreciated were opportunities to learn from each other and amplification of community voice. Some folks mentioned step-by-step ideas and instructions to move through the playbooks. We had a lot of discussion. A lot of folks in our group were working on intellectual and developmental disability, oral health advocacy, looking for materials and resources for that. And I'm happy to say you came to the right place. This is a group that has a lot of those. So get in touch with one of us. We're happy to share it. The other thing that really resonated with folks was the mentorship program. They really liked the idea of supporting new blood, saying that it's critical because it helps you feel supported, because advocacy is often tiring. And the last thing is often looking outside the usual realm of oral health professionals to advocate resonated with folks. And so I will hand it off to, what's our next group? Sorry, I can't see that. Planning and goal setting.
This is Jessica. We were a small group of 3, Tony and Reagan and I, but we had a great conversation about some of the things that are happening in their states regarding Medicaid and the uneasiness of what's going to be happening with the funding. But then we got into conversations about partnerships and how they're so extremely important. And I love what Tony said, kind of wrapping this up, was that partnerships have to be two-sided, but it's a commitment of mutual support each side that leads to sustainability of the partnership and the work we're trying to do. And I just thought that was great. Additionally, Reagan shared with us that the dental group she works with, it's a small clinic, that they did pre-printed postcards that the patients could sign, and then they were all sent to their state officials to give some of that firsthand perspective of what the situation they faced is. So that's kind of what our group talked about, and I will hand it off to someone from implementation, outreach, and events.
Awesome. Thanks, Jessica. Labrine Nelligan. We had a group of 5, and if anyone from the group, we sort of assigned me as the summary person, but if anyone else, please jump in. We had a good conversation as well. And mostly what we talked about is, templates in related to implementation, events, and outreach. While it's always really helpful to have templates and guides, it would be even more helpful to have case studies, real world examples, to demonstrate how other people have succeeded in these areas. Also, love to share examples of challenges and maybe challenges that couldn't have been overcome, so others can sort of learn to anticipate some of these challenges and maybe creatively figure out ways to overcome challenges. So sharing not only the case study success stories, but also sharing the challenges, just where like people are getting stuck. We definitely talked a lot about how resources are really tantamount for implementation outreach events, because those things typically cost money. Knowing that resources are scarce all around and continue to be, how do you creative ways to do some of this type of work in the face of limited resources? And then ideas for partnering with unlikely partners. So figuring out who some of those other partners are that maybe aren't necessarily working on oral health, but are working on other basic needs or working on other innovative things. How to bring more people into the fold, into our narrative, and really kind of getting other people to appreciate that oral health is total health. So I say those were some of the main takeaways from our group. I don't know if anyone else wants to add to that. Great. Thank you, guys. I will pass it along to group 5, evaluation and sustainability.
Thank you, and I was happy to volunteer as the speaker for our wonderful group. And I'm just now seeing the breakout discussion prompts, and we seem to flow directly through them naturally. So we're evaluation and sustainability. And what we first spoke about was, obviously, when you're looking at evaluating, we're looking at data. And we can get focused on data and quantitative, trying to show that story through quantitative means. And our first reflection was that data can be limiting. It's only one chapter in the story, and it's usually not something that can help, that it's not enough on its own to cause impact, help move action, or to help people to fund certain programs. It is a really impactful and helpful part, but then we looked at what actually helps to promote action, and we thought that something that's really important that should be paired with data are the qualitative, meaningful stories. And one aspect that was brought to our group is that there should be, or there was a question about if there is a submission form for patients to collect stories, because there's a lot more weight with certain stories to specific scenarios if you want to get funding for a grant, and that the story fit matters. And there was also discussion about CareQuest. One of the strategies of CareQuest is to build the skills of a lot of its members in advocacy so that they can be able to share these stories, match the stories, and be more impactful with the narrative about why we should be doing certain things at the grassroots level. Lastly, another really important part about the sustainability point that we touched on was, as an organization looking to unify, build coalitions, and we're touching on data, sharing data and being able to reach out and have this tool so that you can compare data apples to apples, and being able to look at not duplicating efforts, and if something's already done, being able to share and know that a lot of these national level, these problems that we're trying to face, they will require all of us to combine our resources and to share and be open. And there's a few different organizations or organized ways of coming together, like organized dentistry, or looking to new partners from CareQuest and connecting and finding a way to expand the blueprint.
Thank you.
Awesome.
Thank you.
Tony, let me just make one more comment. So thank you very much for those conversations. Those were, they were very rich. My experience at my group was it was very rich. It was a great discussion, and clearly all 5 groups really went there. They were thoughtful. There was insight, and you can also take any of your information you might want to add, insight and highlights, if you will, and put them into that evaluation form. I think that Francis may have just put that evaluation form in the chat, or will be doing so again. But that's a place where if you have another there we go. And if you have another comment, it's a perfect place for you to put it in. So thank you so much. I know that for me, that conversation was one I had needed for a long time. So thank you for all of the discussion. And now I'm going to pass to Tony.
And this is what I call the open magic. It has happened again. And unfortunately, our time is gone for today, but we want to thank you so much for being a part of this. That's our second open house. And we hope that you learned something and made some new connections that you can follow up on. We want to remind you to please fill out the evaluation form one more time. Please, please, please. And but closing, I want to say this, that you are the network. You are the movement. So let's keep showing up. Let's keep lifting one another up. Let's keep standing up. Let's keep speaking up. And let's keep working hard every day so that we can have the systems and the changes that we all deserve. So thank you, everybody.
Thank you.